for Juanita too. She should be joining. Welcome to those of you who are just joining us. Sorry, it took me a moment to realize that we had opened everything up. We are just waiting for people to get logged on, and then we'll go ahead and get started. So just hang tight for a few minutes.
Juanita has joined.
I see her. Welcome, Juanita. Welcome to those of you who are just joining us. We're going to give people a couple minutes to get logged on, and then we'll get started. Welcome to those of you who are just joining us. We'll give it maybe another minute or two to let people get logged on, and then we'll go ahead and get started. All righty, Elizar, you want to start recording?
It says it's already recording.
Oh,
so
really? Okay. I didn't get that message, but awesome. We'll go ahead and start then. So welcome everyone. Thanks for joining us. I want to start today's session centering ourselves in a land and labor acknowledgement. This particular version was written by Tess Matsukawa, who's a wonderful member of the advising team for the Public Health Global Health major, and also one of our equity, diversity, and inclusion coordinators. It is vitally important for us to know the long-standing history of where we are and what has shaped the context of the land we inhabit. The University of Washington acknowledges the Coast Salish people of this land, the land which touches the shared waters of all tribes and bands within the Duwamish, Suquamish, Tulalip, and Muckleshoot nations. Land that was stolen by European colonizers. Land that was stolen from the Duwamish, who are still here and continuing to honor and bring light to their ancestral heritage. This country was built on stolen land with the exploited labor of enslaved African peoples, as well as the exploited labor of underpaid Asian and Latinx peoples. These acts of colonialism, white supremacy, and anti-Blackness are the history of this country, as well as our ongoing and current reality. We want to honor and recognize the lives, knowledge, and labor of Black and Native peoples in the past, present, and future. There is an immense need for action within the School of Public Health and all other systems that is centered on liberation for Black and Indigenous peoples. This requires understanding the context of where we are our own positionality within those systems, and a dedication to justice-based action. Thank you again, Tess, for those words. So with that, I am delighted to welcome all of you to the 2021-22 academic year, and what I hope will be a better year for all of us and all of the people worldwide that we care about. This last year has been extraordinarily difficult in so many ways, and I want to take a moment just at the beginning to honor the lives of those we have lost to COVID-19. I'd also like to thank all of you who have worked so hard during the pandemic. You know, we usually return to campus in the fall feeling refreshed and renewed. And honestly, I don't think that there's anyone who I've spoken to this year who feels that way right now. I hear a lot of excitement, people who are invigorated by the fresh start, people who are excited about being back in community with each other, but not refreshed. And I also want to acknowledge that returning to work and school in person brings with it anxieties, and to thank all of you for being patient and kind, not only with each other, but also with yourselves. So with that in mind, while it is easy to get swept up in the excitement of a new academic year, I am trying to remain mindful, and I hope all of you will remain mindful as well, that we are not really starting the year with a full tank of gas in terms of energy and an emotional resilience. So it will be really important to be intentional about what work we take on this year, and to continue to extend patience, caring, and grace to each other. So please don't hesitate to reach out to me if you feel like I am asking too much of you and we need to slow down. And please do continue to take care of yourselves and advocate for yourselves and each other. So with all of that in mind, I wanted to specifically welcome some new members of our community. So I don't think we have the current census data, but Juanita, can you tell us a little bit about our new students who arrived last week?
Sure, our new students, and hello everyone, I'm Juanita. Our new students have arrived across all of our programs. We welcome students to our first DRPH with this cycle, and our second MS capstone program in biostatistics second. We are seeing students come in larger numbers to our nutritional sciences program, food systems and nutrition major. A third group of students coming to our public health, global health major, and then students across the spectrum. I'm sorry if I can't tell you more specific details than that. We do have students who are joining us mostly in person, on campus, and returning to classes. However, we continue to have students in online programs. And then our community is really been responsive to any number of students who have run into travel difficulties in a few different countries and are still pursuing their degrees from international locations, including in South America, Asia, the Pacific Islands. We also have a number of students who are in locations around the United States because they are pursuing their education remotely due to health or mental health concerns that make it difficult for them to participate in person currently.
Thank you. That was
You're
an
welcome.
outstanding update. And you're reminding me that I actually didn't introduce myself, let alone you. So I will take a step back and say, hi, my name is Hilary Godwin, and I'm the Dean of the School of Public Health, and honored to be here with all of you today. You just heard from Juanita Ricks, who is our Assistant Dean for Students, and actually just got an elevation of her role to Assistant Dean. So we're all super excited about that. I also want to introduce Carey Farquhar, who's our Vice Dean for Education. Carey, do you want to just say a few words about, I know you started teaching actually earlier than most of us, just in terms of what you're seeing in terms of students coming back and how things are going?
Yes, thanks, Hillary. So nice to be here. Yeah, so I started teaching a course about 2 weeks before the quarter started. So I've taught that one, and now I'm teaching another one during the regular quarter. And for me, and I think for the students as well, it's been wonderful being back in the classroom. There are concerns, and we spend a lot of time talking about being healthy, which I think is what we'll be discussing on this webinar as well, and staying home if not feeling well. But I mean, generally, it has been just really inspiring to see and hear all the voices of the students back in the room and how engaged they are. I don't remember them being this engaged before the pandemic, but if today's class was an example, I think 2/3 of the class spoke up at some point or another. So hopefully others are having similar experiences. It's going to be up and down, so I'm not saying it's all a bed of roses, but it's so far so good. Thanks.
Awesome. We also have a number of new faculty. This is not an exhaustive list, so my apologies to folks that I missed on this. We tried to capture, at least for right now, the new assistant professors who are in the tenure track series, WOTRF series, and teaching faculty series who have joined since January of 2021. So welcome to Alyssa Billfield, Erica Furmeister, who's actually going to be joining us in January, Emily Hovis, who I've seen because she's on our floor in HRC, Derek Jennings and Michelle Johnson Jennings, Judith Marcelak, Mina Sharif, and Tingy. So we're super excited to have you guys here, and we will work on getting a more comprehensive list that includes folks in the other tracks as well for future meetings. I also wanted to mention that, let's see if we can get this to forward. Oops. Okay, that we have some folks who have taken on new roles, new leadership roles in the last couple months, and wanted to acknowledge those folks as well. So first of all, I've gotten tons of questions about what's going on with Arch, and I'm happy to announce that we're successful in recruiting a fantastic inaugural director, Wendy Barrington, who many of you know because she's had adjunct and joint appointments in our school for many years, but now is fully joint with us here with an appointment in HS Pop. And as of August 1st, has taken on the role of director of the new Center for Anti-Racism and Community Health, and has really hit the ground running. She, within her first 2 months, submitted a huge campus-wide proposal to the NIH for recruitment of more diverse faculty. So super excited about the work that she's doing. Very happy to announce that Barbara Baccaro, who had been interim faculty director for Public Health Global Health, the Public Health Global Health major last year, has agreed to take on that role on a regular basis. And just hearing fantastic things about her leadership in that program. Hopefully many of you saw Deepa Rao has taken on the role of interim senior associate dean, and I'm very grateful for her leadership in that arena. I'm not sure if she's visible here, but Shiva Shafi is our new director for marketing and communications. For those of you who knew Jeff Hudson, Jeff left us almost 9 months ago. Yeah, it was a while ago. And we were super thrilled to recruit Shiva. And then last but absolutely not least, excited to welcome Darren Wade, who has been in the school for a number of years, to an exciting new role, which is Associate Director for Career Development for Student and Academic Services across the school. So lots of exciting new people, and also people in new roles that we're very grateful for. And I also want to give a shout out to those of you who are technically not new to SPH or UW, but who are here on campus for the first time this fall. It's been really fun for those of us who have moved into the new Hans Rosling building to sort of get to know our new surroundings that we technically moved into a year ago. And so I can sort of imagine how exciting it is for folks who moved here to Seattle a year ago and are just finally starting to get to meet and be in community with people in real life. So we're excited to have you guys here as well. Oops, I see something in the chat, so I should open that up. Yes, thank you, Judy. Yes, I definitely need to get the names of faculty who are primary and SOM as well, who are in DGH. So yes, please do send those, and we will do a further update on that at the next webinar. Okay, so I thought I would start by providing a bit of a status update in terms of where we are. And given that we have so many new members of the community, I wanted to give a little bit of background as opposed to sort of assuming that everyone knows the background about how the University of Washington is managing and responding to the pandemic, but specifically where we are right now. So if you have not done so already, please make sure that you check out the University of Washington's COVID landing page. Now, let's see if I can show this, put this in the chat. There we go. And I just wanted to point out, this is really our key spot for communicating information related to the pandemic to the UW community. It includes information about vaccination requirements and COVID policies and guidance. It also includes links to our own data dashboard for the University of Washington, how to contact environmental health and safety at the University of Washington, what to do if you think you might have COVID, and how to sign up for the Husky testing program, all sorts of great stuff. So if you have not looked at it, or it's been a while since you looked at it, please do check it out. We also have here in the School of Public Health, have our own COVID landing page. And I'm hoping that maybe the communications team will while I'm talking, put in links to that so that people can check that out as well. Hopefully at this point, everyone is aware, but I figure it's worth mentioning that we have both a vaccine and a masking mandate here at the University of Washington. Detailed information about those requirements and other safety precautions on campus are available on the Environmental Health and Safety, or what we refer to as EH&S website. That also is a really good resource for folks. I wanted to make it clear because there's been a lot of communications, but I know it's hard to follow everything. That the vaccine mandate, which is required for all individuals who are state employees or working in K through 12 education or higher education, comes from Governor Inslee. And there's a deadline that individuals either need to be vaccinated or have an approved exemption by October 18th. That's through the governor's mandate. There's a two-step process that's involved in this from an operational sense. The first step is that every employee needs to attest to their vaccine status in Workday. And then the second step is that vaccine status needs to be verified or validated by a member of the UW HR team, for instance, by looking at seeing a physical copy or a reproduction of that individual's CDC vaccine card. So we in SPH and the rest of campus are currently in the process of validating, so doing that verification process for employees, and that includes faculty, staff, and student employees. I do want to mention that, so hopefully most people have actually done the attestation. If you haven't done the attestation at this point, that portal in Workday is actually turned off. So if you have not attested, you need to actually go, and you are vaccinated, which then we want you to communicate that to us. You should be reaching out to your HR team. They can actually do both the attestation and the validation at the same time. But at this point, it needs to be done by an HR person as opposed to the employee directly. I also want to point out that there's a separate vaccine attestation process for students. So students, instead of going through Workday, need to upload their vaccine information through a student portal. And in the case of both MPH students and HIHIM students who are part of the Health Sciences Immunization Program, it actually goes through a separate system. So if you are a student, regardless of whether you're in one of those specific programs, I'm going to put in the chat box the link to where students go to. I want to emphasize, however, that students who are employees must attest both through the student portal and through Workday. So right now we do not want to have to terminate individuals because they haven't done their attestations. So we're frantically trying to find all the people who haven't yet attested or haven't yet been verified and get them in the system and get that worked through. There are a significant number of those individuals who are students who are employees who probably didn't realize that they had to do it in both places. So if you're one of those folks, please reach out to us so that we can get you in the system. So as of right now, what we're seeing is that of the people who have attested across campus, so this is in all categories, employees and students, that between 95 and 98% of those individuals have indicated that they are vaccinated. The remainder are individuals who have requested either a medical or religious exemption. We do not review those exemptions here in the school. For employees, that's done by central HR, and for students, that's done either through the Health Sciences Immunization Program or through this centrally through student services. So if you are someone who asked for an exemption, you should be finding out this week or at the latest the beginning of next week whether or not that exemption was approved. If you have not yet had your vaccine status validated, so your vaccination status validated, that needs to be done by October 11th, next Monday. So really important deadline, because that's the point at which the university will start compiling the list of all the individuals who are not valid, have not had their, thank you, Megan, for putting that in there, have not had their vaccine status validated. They will start preparing that list with the idea that individuals that fall into that category who aren't in the system by October 18th will be placed on unpaid leave on October 19th and will receive formal notification that the university is initiating termination process. So it's really important. Even though you technically have until the 18th, we're really pushing to try and get everyone in the system by the 11th so that we have a little bit of a safety net in terms of time. Campus-wide, there's still over 1,000 employees who have not completed their attestation. So obviously this week we're, as a community, really working on trying to reach those individuals. But what we're seeing in SPH is that greater than 98% of those who have attested are vaccinated. And for us in our own unit, we've completed about 94% of the required validation. So we're doing good. Huge thanks to the HR staff who have been working tirelessly to get all that done on a very short deadline that was set by the governor's office. So how are we doing in terms of COVID cases on campus? As of this morning, we had just over 170 individuals in the UW community who have tested positive for COVID and are still in their isolation period, which is usually about 10 days since onset of symptoms, but can be longer under some circumstances. Not surprisingly, the majority of those individuals are vaccinated because the majority of our community is vaccinated. For most of them, they got tested because they were exhibiting mild to moderate symptoms. We don't have any reports of members of the community right now who are hospitalized with COVID. Of those 170 people, less than 10% are employees. The remainder are students. 71% of those individuals are members of Greek organizations, and about 10% are students living in residence halls. So as a result, the Husky coronavirus testing program folks have activated surge testing in the affected Greek houses and residence halls to try and identify whether or not there are other people in those communities who are also positive. So that's sort of where we are right now. I think it's also worth going through some of the precautions that we expect that everyone should be taking. I want to say huge kudos to our students. I know there was some anxiety about whether or not students would be compliant with the masking mandate, and I've universally heard that students have been fantastic about it, not just in the classroom and in the buildings, but even out walking around campus. I'd say 9 out of 10 students that I see are wearing their masks, which they don't even have to be doing outside, but we're thrilled that they're doing. So that's been really fantastic. And I've, for the couple of cases that I've heard of people not wearing masks, when people have reminded them, they've been really great about putting them on. So that's been really reassuring. So yes, so wear a mask when you're on campus. But you should also be wearing a mask anytime that you're out in public or with people who are from outside your own household. So what we have seen during the pandemic is that in our community, at least, the majority of individuals who end up testing COVID positive tend to be getting that most likely are getting it from social interactions as opposed to workplace or classroom interactions. So it's just really important that we all remain vigilant in terms of when we're socializing with other people. Another really important thing is, if you have not done so already, please sign up for the Husky testing program. So the Husky testing program is not required, although individuals who are not vaccinated who receive exemptions will have weekly testing requirements, but it doesn't have to be through Husky testing program. But it's a great resource. So Husky testing program has kiosks on campus where you can get tested. They also, if you're not feeling well and you're at home, they will courier a kit to you so you can test at home and then pick up the test. And they have a great turnaround time. So it's just a really great resource, and I highly recommend it. The other thing that we really want people to do is to activate the WaNotify app on their cell phone. So again, not required, but strongly encouraged, and for reasons that'll become apparent when I talk a little bit more about how the contact tracing is working on campus. Another really important reminder is that you should not come to work or class, or honestly even go out in public, if you're experiencing any symptoms of COVID. So students, if you're experiencing symptoms, please notify your instructor that you're experiencing symptoms and that you need to switch to remote instruction mode. They will understand that and they will appreciate that you're being proactive about it. Employees, you should notify your supervisor that you're experiencing symptoms, and if you're too sick to work, please do take sick leave. If you feel like you're able to work, you're only having mild symptoms, you are welcome to switch to working remotely. You just need to notify your supervisor that you're doing that. And again, people will be happy to support you in that. If you are experiencing symptoms, you should get tested for COVID. And as I like to say, stay out of circulation until you know that you don't have COVID-19. And again, Husky testing program is a great resource for that, but we also have fantastic testing with really quick turnaround through UW Medicine. So if she can find it, hopefully she will put the link in there to Public Health Seattle and King County's website. Their website, they have, again, fantastic dashboards and also really great references to local policies. but they also have a great list of all the testing sites that are in King County, including a link to UW Medicine ones, which are really close to us and convenient. Okay, what if you have a known exposure to COVID? Here, I would say the important thing is that you follow the instructions for symptom monitoring, testing, and quarantining that are provided to you by the contact tracer that lets you know that you've had an exposure. And the reason I'm framing it that way instead of saying you should do A, B, and C is it really depends on what you do, really depends upon whether or not you're experiencing symptoms, whether or not you were a close contact, some other issues, personal health issues or situations. So it's really important that you answer the contact tracing calls when they come, whether it's from DOH, Public Health Seattle and King County, or our own environmental health and safety contact tracing folks, and ask them all the questions that you have. But I would say, really absolutely critically important that you engage in symptom monitoring and follow that closely. I did want to point out that there is no longer a physical distancing requirement on campus for either classrooms or work environments because we have a vaccine mandate and a masking mandate. So that transition happened back in June of 2021. So this June. So it's been a while, but I know it's something that I've gotten a lot of questions about of why do we have regular density in the classroom? And that really comes down to the fact that we're very privileged to be in a situation where the majority of our population is vaccinated and at low risk for severe disease, but also lower risk for transmission. Okay, so what do you do if you or someone that you know tests positive? I would say probably the most important thing that I can think of besides taking good care of yourself is to immediately notify environmental health and safety, either by email or by phone. And so I put the email in the chat as well as the phone number. And again, just as a reminder, for the University of Washington, Contact Tracing Authority has been delegated from Washington Department of Health and Public Health Seattle and King County to our own environmental health and safety. They use the same protocols and they put information into the same system and they coordinate with our practice partners. But it's really important that you read and respond to both emails and calls from environmental health and safety. So typically those emails are coming from covidehc@uw.edu, but certainly if you get a phone call that you're not expecting, that's a local call, please pick it up. If you are a student, you have been, you know that you have a known contact to COVID, you may wish to, I'm sorry, if you're a student and you test positive, you have to let environmental health and safety know. You do not have to let your instructor know. Environmental health and safety will reach out to your instructors and let them know. But you are welcome to notify your instructors to let them know that you will not be in class for at least 10 days post onset of symptoms. So you should feel free to do that. If you're an employee, again, you need to contact environmental health and safety, but you are welcome to let your supervisor know as well. You don't have to tell them that you have COVID, but you do need to let them know if you're taking sick leave or you're shifting to work from home. And it would be helpful for you to let them know that you expect that to be for at least that 10 days for the isolation period. If you are an instructor and one of your students tests positive, you may receive one of two different types of emails from environmental health and safety. One type of email is an email letting you know that your student will not be in class, and that comes from environmental health and safety, and that you need to accommodate them. In that email, because it's specific to an accommodation for a specific student, it will contain the student's name and will identify that the reason is because they are COVID positive. That email is confidential and should not be shared. So That is just for you as an instructor, the same way that you would get something from DRS about a disability accommodation. The second type of email that you might receive as an instructor is one letting you know that a student who later tested positive attended your class while they were potentially infectious. That type of email doesn't say who the student is and will contain specific guidance about what information you're allowed to share with whom, including a template of an email that can be shared with other students or TAs in your class. If you receive either one of those kind of messages, please be sure to let your department chair know. They don't get notified otherwise because they're not a contact. But please do not forward the name of the specific student. It should just be, you should just let them know that you were notified there was a student that was positive in your class. Please note that you will only receive direct notifications from Environmental Health and Safety or Washington Department of Health, Public Health, Seattle and King County contact tracers about possible exposures if you were identified as someone who is a close contact. EH&S can't do this for just because you were sitting next to someone in class. They don't have that level of detail because not everyone knows the names of all the other students in their class at this point. Again, what's really important is that you follow the instructions that you receive from the contact tracer about what you should do next. It likely will involve symptom monitoring, but depending upon your vaccine status, could be that you need to quarantine. So please be sure to look for those communications and respond to them. Please note that if you're vaccinated and asymptomatic, even if you have a known exposure, you don't necessarily need to quarantine. However, we in the School of Public Health would support you if you wish to do that. So if you wish to switch to remote instruction or work from home because you've had a close contact, let your supervisor know, let your instructor know, and we will do what we can to make special arrangements to help you with that. If you're an instructor and you test positive, you'll need to switch to remote instruction for at least 10 days after onset of symptoms. So all instructors should be prepared, ready to know what they're going to do in that case. Let your class know how you would notify them, and please keep your department chair in the loop, because again, they won't get direct notification unless you happen to tell the contact tracer that you were in close contact with them. So I get a lot of questions about, like, you know, why are these things different? Like, why it used to be that if you were a close contact, you had to quarantine. Now maybe you don't. And it really comes down to a question of what the relative risks are for unvaccinated versus vaccinated individuals. And so what we've learned about that. So it's not that there's no risk that someone who's vaccinated will end up getting COVID or passing it on, but that the relative risk is lower. So here I want to point you to just a great resource that we have on the King County dashboard. They have this great dashboard that specifically shows relative risk for us in our community for unvaccinated versus vaccinated individuals for acquiring COVID, having severe disease and hospitalization, or dying of COVID. And so I just want to point that out. It's a great resource. And happy to answer questions about that as well. So at this point, maybe I'll talk a little bit about how did we end up with these specific policies at UW, and then we'll sort of open it up for comments and questions. So one thing for sure that I want people to be aware of is that the University of Washington, I feel incredibly fortunate to be here as opposed to in another city, state, or university, because we have elected officials who respect public health and work with public health officials. We also have university leadership who values public health and are committed to staying aligned with current public health guidance. Usually, our local public health guidance is the most protective compared to for instance, CDC guidance. So we typically align with the guidance from Public Health Seattle and King County. We are also subject to mandates from, usually not from the CDC, although occasionally, but usually mandates coming either from DOH or from the governor or from our local agencies, which is Public Health Seattle and King County. So those constrain what our different options are. When there is room for the university to make decisions, the following process is used. So we have two different committees that are making recommendations. The first is our Advisory Committee on Communicable Diseases, which is charged with making recommendations based on the best public health information that's available. And we're fortunate that ACCD is chaired by Jeff Gottlieb, who's an attending physician in infectious diseases in the School of Medicine. He's also the director of the HSIP program and a faculty member in the School of Public Health. And in addition, our own Associate Dean for Public Health Practice, Janet Baseman, also serves on ACCD. Those ACCD recommendations go to another committee that's called UW Incident Command. And that group is made up of people with a broad range of different expertise across campus. And that group is charged with figuring out how to operationalize the recommendations that come from ACCD and how to balance the public health guidance with different operational constraints. So an example of where we have to balance with operational constraints are, for instance, sometimes we can't make decisions without consulting with unions first. So it's really helpful to have Mindy Kornberg, who's the head of HR on Incident Command, to say, hey, we can't make that decision on our own. We have to do consultation first. I also serve on Incident Command. I'm there both as the Dean of the School of Public Health and as because I serve as chair of the Board of Deans and Chancellors. Obviously, a big part of my role is reminding that committee about what the origin of the public health guidance is and making sure that we stay aligned with that. Those recommendations from Incident Command and ACCD then go to the president and provost, who make a decision, which is promulgated either through EH&S policy, or in some cases executive order, or sometimes it's just simply communicated out to the UW community by email. So it's really important, if you see emails from the president or provost, please do read them. They're often contain very critical information these days. In some cases, after all those layers of decisions are put in place, there is an ability to do some local decision making. And here I, as Dean, consult with the leadership team and whenever possible, also with faculty, staff, and students. So some examples of where that consultation has been really critical in the last year. One is a huge thanks to Carey for organizing a committee that was involved over the spring and summer, talking about back to school in-person issues, but input from students and faculty during the spring and summer was absolutely critical to our decision to really require faculty, if at all possible, to record lectures so that students who couldn't be here in person could still finish their degrees and move forward in their degrees. But not to require faculty to teach in high flex mode, which we quickly discovered was not feasible operationally because we didn't have the setup, and also not within the realm of practical for most of our faculty. So that was something where we came to a much better decision with all of that feedback and lots of consultation sessions. Another example of where the listening sessions have been absolutely critical was staff feedback that we had over the spring and summer. We knew that coming down the line, we had in the spring been notified that there was an intention to come back to campus in person starting on September 13th, and that we needed to prepare for that. And it was really the feedback that we received from staff and faculty at listening sessions and webinars in the spring and summer that led us to a decision that most of our staff would work on a hybrid telework schedule for the fall quarter as opposed to working predominantly in person. So where we are right now is that most people are working, I would say, 2 to 3 days in person. And in some cases where individuals are not interacting very much with students at all are working as much as 4 days from home a week. And that really was in response to requests and from that community. And I just wanted to end with sort of saying that sometimes we don't have the option of deviating from university policy. So for instance, like whether classes would be in person this fall. And I just wanted to reassure all of you that I do use my position on incident command to really advocate for requirements that are aligned with current public health guidance, and including making sure that we had the masking mandate, the vaccine mandates, all of those, and also to forward concerns that are raised by members of our community. So I appreciate all of the input that you guys provide. Encourage you to continue providing it. We do hear you. I know it doesn't always, we don't always land in exactly the place that you'd hope we'd land, but we are listening. We appreciate your input. And I know that Janet feels the same way about in terms of providing feedback to ACCD as well. So with that, I'm going to stop and let us use the last 15 minutes for questions that people might have. So feel free to, it looks like we have one question in the Q&A. I guess we'll start with that one. So the question is, it's unclear to me, are we required to have a vaccine requirement for all in-person events that are hosted by UW and that include non-UW community members, or is having the vaccine requirement left to our discretion? Uli or Meghan, would one of the two of you be willing to field the answer to this? And if not, I'll take a stab at it.
I think Juanita already tried to take a stab at it in the Q&A. I'd have to know more about the event. I just don't know that I have a blanket answer to all of this. It depends on how many people are coming, and
yeah, that's what I was going to say as well, Uli, is that I think there is a size at which there starts to become some requirements, but I don't know specifically what that size is. Someone says, for example, a seminar that's open to the public. We're encouraging people to reach out to EH&S about specific events that they are planning, both so that you know whether or not you're required for that event to check vaccines, and also to make sure that the way that you're checking them is consistent with university policy and guidance.
I would just like
yeah.
to, sorry, I would just like
go
to
ahead,
add
Juanita.
that, sorry, there's one other place that requirement may be made, and that is by the venue operator.
Mhm.
There are some campus venues that are requiring that a vaccination check plan be put in place and that vaccines are required in their venues.
Good to know. Okay, this is why we have panelists, so we can provide good comprehensive answers. Other questions?
Hilary, I could, as the questions come in, I could just
go ahead.
jump in to say, to remind people, especially the instructors, but also students, that we have 2 TAs hired through the Office of the Dean to support instructors and students with technology issues, challenges, or just getting training on how to use the technology in your room, how to save, record to the cloud, and post, and prepare Canvas sites. So both technology as well as instructional concerns that people might want some assistance with. So I'll put their email in the chat. It's sphta@uw.edu, and you just email that, and then you can make an appointment, and they will either meet you on campus or you can do something remotely that would help. So please use our 2 TAs. They're wonderful, Meghan and Jeff, both graduate students in our programs.
Yeah, I would second that. They are fantastic, and I know even for me, when I was teaching on Monday, Juanita was there with me, that we were, I thought because I knew how to use the AV systems in other HRC rooms that I would know how to use the AV system in the HRC classrooms, and I did not. So we struggled with that, and I got an email from a student saying, it seems like instructors are having difficulty, and I said, yes, even me. So we have these great TAs, and at that moment I thought, and I could contact our great TAs, and they immediately responded. So I have now resolved my particular issue, but I would say endorsement for the TAs who are great. I did get some, to go to sort of some of the questions that we've been getting this week. I have gotten questions from a number of staff asking why it is that staff who are not working with students need to come back to campus at all. And I figure it's worth sort of reiterating that decision. Well, first of all, that was a university-wide decision, was to come back to campus in person as of September 13th. And we were given some discretion at the unit level in terms of, so anyone who is going to be working either fully remotely or partly remotely needs to have a telework agreement in place. And so we did many consultative sessions with staff over the spring and summer to talk about that, and heard a lot of angst and anxiety from staff about returning, particularly once Delta variant came back. So that was one factor that we were weighing, and one reason that we really landed on, we have very few people who are working 100% in person. Most people are doing hybrid telework. But the reason that we landed on that we would not have a lot of people who are doing 100% telework was that the other thing that we heard during those consultative sessions was that people felt that it was important that we not have two classes of staff within our school, i.e. people who have to work in person and people who do not. And that really what we were searching for was a solution where there are extra responsibilities that fall on those who are physically present, but there's also an important sense of community that's built with having people be physically present. So based on that feedback, that was why we landed on having most of the individuals in the school working a hybrid telework schedule, with those who have more student contact or are in supervisory roles where they need to be there for sort of response to situational response. That those individuals tend to be working more days on campus, and those individuals who have less or no student contact tending to work from more of their days from home. I see a question from Chuck. Chuck says there have been a number of upgrades to software over the past 18 months, which have resulted in things not working exactly the way they did before the pandemic for the technology, both on campus and remotely. Amen, Chuck. So true. And for those of us who relocated to the Hans Rosling Center, which we love and is gorgeous, most of us moved here during the pandemic and then immediately went home. So I know for all of us, we went through a period of struggling with technology stuff. And now again, as we're entering into the classroom. So completely agree, Chuck. Huge thanks to the TAs who can help with the instructional space, but also to our great IT folks who are great about responding. So I would just say, call on your IT folks, reach out to the TAs, try and be proactive. But yes, you're right. There's a lot has changed. So yeah, and I did, when the student asked if there was something we could do to help faculty, besides saying we're trying and providing that information, I also did say, but we're also just really asking for people to be patient and give each other grace, because it's just a lot of moving parts all at once. Other questions? So another one that we heard was questions about whether or not there were any private spaces for students to be able to Zoom if, for instance, like their instructor was sick and so they had to Zoom for one class, but were attending in person for other ones. So like in the middle of the day had to stop and do Zooming. Uli, do you want to address that one?
I just would say in HRC, there are a lot of open spaces that can be used for that. It's not, your personal private closet that no one can hear you. but there are just a lot of open spaces that can be used and are meant to be used for any number of purposes, but especially for students doing work or studying or attending class. The one thing we've gotten some questions on are about the wellness rooms, and we are not, walking around enforcing it, but wellness rooms are absolutely not for studying. They're also not for staff to go closet themselves. The wellness rooms are meant for people with wellness needs, and that's ranges anywhere from, meditation and prayer to lactation or feeling sick, feeling stressed, and they need to stay open for that and not to have people take them up for those things so that we can use them. We're not used to having wellness rooms, so we're all getting used to this. And we also are getting used to working more in open spaces. So staff and students, I like hearing the noise. It's great to hear the noise. So I think this business about disturbing other people is something you need to take off your shoulders. And it's really fun to see the life in the building. And it makes a huge difference, especially if you haven't walked through it, walk through the downstairs and the first floor. It's quite full, and it's nice to hear the buzz. The upper floors are slowly filling up a little bit more, but I would say if you're looking for a quiet space, I can point you to 3 dozen, because I walk the building every day just to see where we are. And we still need to keep sort of opening ourselves up. We've come from very territorial spaces, and we like to mark them. And that's really nice. I like the marking, but the building conference rooms are open for all. So they're not your conference room. They're open for all. And that goes for even things like the kitchens. They don't just say mine on them. We're going to have to work to keep them clean. And it may go for the refrigerators. I like the marking of the refrigerators, but at the same time, maybe I could share with somebody and it would be just fine. So we're all adjusting to some of those different openness concepts. And I would just say that students finding a corner and attending a class is part of that openness. We want to actually hear that.
Agreed, Uli. It's been really great to see students in the building. The first floor is really it's a happy place.
Yeah.
I just wanted to add another quiet, or maybe Uli's saying ours is not such a quiet place, the first, second floor of Rosling, but the library, I was in the health sciences library today. That's a quiet place. And there are rooms that can be reserved for students who might want to do a class there. I was in one of those reserved rooms, but also just walking around. There are quite a few students there, but there's a lot of space. It's open, but it's quiet. So just a plug for that.
All right. Well, we have a very quiet audience today, maybe because we have a relatively small one. But again, just wanted to thank everybody for your patience and grace with each other and yourselves. To welcome our new folks, welcome everyone back to campus in person. Again, recognize, as Carey said at the beginning, it's not all joy. There's still stressors and angst. But I at least am finding that I'm happy to have the joyful part of reuniting with members of our community, and seeing students is a nice antidote to the last 18 months. And even though it comes with some additional angst and anxiety, really just happy to see everybody and to be back in community with everybody. So wishing you all well. And again, please don't hesitate to reach out if there's any way that we can support you better.
Thanks, Hilary.
Okay, bye.
Bye-bye.